Welcome to today's video, guys. As part of exploring the complexities of mental health and the different experiences that people may have, today we're going to discuss the broad topic of psychosocial disability in general. This is a term used to describe a range of mental health conditions that can impact a person's social and emotional functioning. It refers to a disability that arises from a combination of psychological and social factors, such as traumatic life events, poverty, discrimination, and social isolation. As always, you'll be getting a bonus towards the end of the video, and today's will be something really interesting about psychosocial disability, so be sure to stay till the end. Welcome to Wellness Lenses, where we talk about mental health and the journey to self-development. Without further ado, let's dive in. People with psychosocial disabilities may have different conditions, including depression, anxiety, personality disorders, and post-traumatic stress disorder. These illnesses can make it difficult for individuals to maintain healthy relationships, participate in social activities, and work effectively. But with the right treatment and support, people with psychosocial disability can still live full and meaningful lives. There are different types of psychological disability. Let's talk about these. Psychosocial disability is distinguished into various types, each with their own set of symptoms and treatment approaches. We are going to look at each subtype and how it manifests itself. First category is mood disorders. These are conditions that affect an individual's emotional state and include depression, bipolar disorder, and seasonal affective disorder. Let's take a closer look. So what is clinical depression? This is a condition that psychiatrists define as a persistent feeling of sadness or loss of interest that can really affect a person's life. Some of the symptoms and characteristics of clinical depression include feeling down all the time, losing interest in things that used to be enjoyable, having trouble sleeping or sleeping too much, struggling to get things done, feeling anxious or crying a lot, being easily irritated or isolating yourself from others, having difficulty concentrating, experiencing changes in appetite such as overeating or not feeling hungry at all, and even having thoughts of suicide. Another notable mood disorder is bipolar disorder. This is a mental health condition that involves mood swings with periods of extreme highs, or mania, and extreme lows, or depression, lasting from days to months. When someone with bipolar disorder is experiencing a depressive episode, they might feel unmotivated, lack energy, and lose interest in things they usually enjoy. On the other hand, during a manic episode, they may feel elevated or euphoric, engage in risky behavior, or struggle with impulsivity and disorganization. Other symptoms may include delusions, difficulty concentrating, difficulty sleeping or sleeping too much, and paranoia. Another type of psychological disability is anxiety disorders. These are conditions characterized by excessive worry and fear, such as generalized anxiety disorder and obsessive-compulsive disorder. People with anxiety may experience panic attacks, have trouble controlling their worries, struggle to focus, suffer from insomnia, have unwelcome thoughts, and feel irritable. Obsessive-compulsive disorder, or OCD, is a type of mental health condition that can cause a person to experience obsessions or reoccurring thoughts, which then result in compulsions or repetitive behaviors. OCD symptoms can manifest in several ways, including repeating certain words or movements, engaging in ritualistic behavior, such as performing tasks in a specific order or at specific times, being hypervigilant and constantly checking on things like locks and stove burners, impulsivity, compulsive cleaning or organizing, and isolating oneself from others due to embarrassment or shame. Anxiety is a common feeling associated with OCD, leading to panic attacks or constant fear. The repetitive thoughts associated with OCD can be distressing and challenging to control, potentially leading to depression. Additionally, some people with OCD might develop food aversions or restrictions as a way of gaining control over their obsessive thoughts. The second broad category of psychosocial disability is psychotic disorders. These are conditions that affect an individual's perception of reality, such as schizophrenia and delusional disorder. Schizophrenia is a mental disorder that can make it hard for a person to feel, behave, and think clearly. It's a pretty complex condition that takes a huge toll on the affected person. One of the main things you might notice with schizophrenia is that a person's experiences or thoughts might seem out of touch with reality. This is especially dangerous because these people can harm themselves while in that state and hence require to be watched at all times. They may also have difficulty concentrating, which can make it hard for them to stay focused on tasks or conversations. Some people with schizophrenia might seem really excitable or agitated, while others may seem withdrawn or unresponsive. Memory difficulty is another common symptom, and they may have a hard time organizing their thoughts. Compulsive behavior is also a possibility, as well as feelings of hostility towards others. Personality disorders are the third broad category when talking about psychosocial disability. These are mental health conditions that disrupt a person's thoughts, actions, and emotions, deviating from typical patterns. Individuals with personality disorders tend to exhibit persistent behaviors, feelings, and thoughts that may result in discomfort for themselves and those around them. Various types of personality disorders exist, each with its unique symptoms and attributes. For instance, borderline personality disorder is characterized by emotional instability, fear of abandonment, and impulsive actions. Narcissistic personality disorder is distinguished by feelings of grandiosity, insatiable desire for admiration, and lack of empathy for others. Avoidant personality disorder may lead to social withdrawal, anxiety, and intense fear of rejection. Before we move on to symptoms of psychosocial disability, if you're enjoying this video so far, please hit that subscribe button for more content like this. It would really help our small channel grow so we can make even more videos for you. General symptoms of psychosocial disability can vary widely depending on the specific condition and individual. However, some common symptoms may include mood swings, anxiety, and irritability. Because of their condition, people with psychosocial disability often find it difficult to have social interactions, causing them to avoid social activities and end up withdrawing from friends and family. It is not strange to find a person with psychosocial disability zoning out of a conversation. This is because they have difficulty concentrating or paying attention to tasks. So the next time you are dealing with a person with this disorder, they may happen to zone out. Please understand that this is something out of their control. Now that we learned about some of the symptoms, let's take a look at some of the causes of psychological disability. Psychosocial disabilities can have a variety of causes. Some mental health conditions have a genetic component, meaning that they are passed down from family members. However, having a parent with a psychosocial disability is not a guarantee that you will get it too. Trauma is another known cause of psychosocial disability. Trauma works by disrupting a person's sense of safety, stability, and control, and by affecting their ability to form and maintain relationships with others. Trauma can encompass various events such as abuse, neglect, natural disasters, war, and violence, and can trigger emotional and psychological reactions, including anxiety, depression, PTSD, and other mental health conditions. Chemical imbalances in the brain can contribute to development of certain mental health conditions, such as bipolar disorder and schizophrenia. For example, dopamine is a neurotransmitter that helps regulate movement, motivation, and pleasure. And when there is too much or too little of it, it can lead to changes in mood and behavior. Prolonged exposure to stress is yet another cause. It leads to changes in the brain that increase the risk of developing mental health conditions. So what is the treatment for these conditions? There are a variety of treatments available for psychosocial disabilities, and the most appropriate treatment will depend on the individual's specific needs and circumstances. Here are a few common treatments. Psychiatric medications can help regulate brain chemistry and alleviate symptoms associated with psychosocial disabilities. These medications should be prescribed and monitored by a qualified healthcare professional. Another form of treatment is therapy, which includes cognitive behavioral therapy, or CBT. This type of therapy can help individuals learn coping skills, identify negative thought patterns, and develop healthier ways of thinking and behaving. Support groups can also be helpful as they provide a safe and supportive environment where individuals can share their experiences with others who are going through similar challenges. Another treatment form is making lifestyle changes, such as regular exercise, healthy eating, and getting enough sleep. Last but not least, some individuals may benefit from alternative treatments such as acupuncture, meditation, or yoga. It's important to note that there is no one-size-fits-all approach to treating psychosocial disabilities. Treatment plans should be individualized and may involve a combination of different approaches. If you, or someone you know, is experiencing symptoms of a psychosocial disability, it's important to seek help from a qualified healthcare professional. Now, before we round off this session, as I hinted at the start of the video, I'm going to share with you a lesser-known fact about psychosocial disability. Did you know that women are at a higher risk of getting affected by this condition? Multiple studies have indicated a distinction in mental health disorders based on gender. For instance, women have a greater susceptibility to psychiatric illnesses compared to men. Additionally, separate research has highlighted that women are at a heightened risk of developing mood disorders, particularly anxiety and depression, in comparison to men. It's an interesting observation, and for now, it's beyond the topic of discussion for this video. There are some mental health conditions that affect men more frequently, such as substance use disorders and antisocial behaviors. This has been attributed to both genetic and biological factors, as well as social factors, but precise reasons why women are more affected than men are still unknown. And with that, we'll wrap up today's session. If you found this video helpful, please like and tell us what you thought below so we can continue our conversation about this important topic in the comments section. And don't forget to subscribe for more content like this. See you soon.